it's Kelby Hightower with MedicareHub, and one of the biggest questions that I get during the annual enrollment period, which is from October the 1st to December 7th, this is the time of the year that the federal government or Medicare gives you the ability to change your health care plans. And that leads me into the problem a lot of times that I hear is the confusion wrapped around which Medicare Advantage or Medicare prescription drug plan or Medicare supplement plan, what health plan options can you actually change during this annual enrollment period time frame from October 15th to December 7th. You can have 8 weeks to be able to change as many times as you want certain health plans. And some plans you can actually do 12 months out of the year. So I'm going to take just a second to explain this to you, and hopefully this will be a tool and resource for you to kind of help eliminate some of the confusion. Also, with all the TV advertisements, the mail, what I call hooks that are thrown out to you. A lot of times people are trying to get you to call, and in reality it's only 2 health plan options you can actually change during the AEP season. Let's cover those. So one, this is a guidebook, a little guide that we use to explain to our clients and people asking questions about Medicare. This explains really the basics of Medicare, so you can actually click and get this below. Also, there's going to be a link below of some other information about AEP season that would be helpful for you guys to be able to read. So your Part A and Part B, actually this is kind of like a key that unlocks the door to make you eligible to enroll into health plan options. And the 2 major primary health plan options that cover your medical and your hospital needs are going to be what they call Medicare Advantage plans, or MAPD, or Part C plans, or private insurance, private Medicare health plans. Everyone puts a spin on it, but it's Medicare Advantage plans or Part C of Medicare. Those are synonymous. And these are the plans that if you have Medicare A and B from October 15th to December 7th, Medicare gives you the ability to enroll, disenroll, or change your plan. And these plans a lot of times they're going to cover your hospitalization, your medical, they're going to cover your medication, or if you are a veteran and you're not needing medication, they can have a plan that's just a medical and hospital plan without the medication. And you'll see all these advertisements about all this cool stuff like dental, hearing, vision, over-the-counter, buyback options. Anything that you see on TV typically is talking about some form of Medicare Advantage plan. Depending on your income status, if you're qualified for extra help, Medicaid, if you're not, if you have a retirement and you have a recurring income that's coming in that's higher income, you can still qualify for these plans. So this is AEP season is when you can change your Part C or Medicare Advantage plan. The second option is if you have A and or B of Medicare, the federal government Medicare gives you the option to change your prescription drug plan, or Part D. And your Part D plan, for some of you guys that have an employer plan and they don't provide like a retirement employer plan but doesn't provide the Part D plan, a lot of those types of people call us and say, hey, I need a prescription drug plan. Well, guess what? This is the time of year you can change. For you guys that are on Medicare supplements and you're looking to change your drug plan, this is the time of year from October 15th to December 7th that Medicare gives you the ability to change this prescription drug plan. So A and B opens the door to allow you to change your Medicare Advantage plan during the annual enrollment period. And it's going to pop up the dates here on the video for you to remind you what those dates are. A and or B will allow you to change your prescription drug plan. Now, this leads me into the dilemma I often hear. People that have a Medicare supplement, that is a Medigap, Medicare supplement, or what Medicare now calls as a Plan E, you can actually change your Medicare supplement 12 months out of the year. There's not an enrollment season that allows you to change your Medicare supplement. Medicare supplements are an underwritten product. That means when you turn 65, if you enrolled into it, you're guaranteed to be able to enroll without any health questions. But past 6 months, past your 65th birthday, unless you've been on an employer-based plan and you're going on to a guaranteed issue Medicare supplement. But when you're 65 and 6 months, beyond that, the 7th month and beyond, you're going to be asked a series of underwriting questions from the carrier that represents the Medicare supplement that you're looking at. And this is going to be like your Plan F, your Plan G, Plan N. There's different, it's kind of like the alphabet soup. There's different alphabets, letters that recognize what Medicare supplement. Most people, most of our clients have an F, a G, or an N. Those are the three probably the most popular that our clients are enrolled into and want to be educated about. So these has nothing to do with the annual enrollment period. The annual enrollment period only governs around Medicare Advantage and prescription drug plans. So if you're looking to change your Medicare Advantage plan, you're needing help with that, you can call someone like us. We'd love to be able to walk you through a review, educate you on how Medicare works, your health plan options. If you're looking at a prescription drug plan, the same thing. We'd love to be able to help you. Or if you have an existing agent that does an excellent job, call them. Have a relationship with somebody that knows what they're doing, that has experience and has years of experience. Lastly, guys, one of the things you do not want to do, and often people do, is they'll pick the phone up and they're calling a telephone based on an advertisement, and the advertisement will make it appear as if it's too good to be true. So my parents raised me to be very logical in thinking. If it seems to be good, seems to appear to be too good to be true, guess what? It probably is. And if you get on the phone with somebody that's brand new in the industry, that's a licensed agent, 3 months, 6 months is the typical average time that most of those call center agents have been in the industry. A lot of times they're trying to help you. A lot of times they have a big heart. They love people, but they're an amateur in the Medicare space. You need to deal with somebody that has a seasoned history of doing Medicare, like our agency. Everyone in our office has a longevity of being in the industry. They know how to guide people, walk them through, answer questions, and provide the professional approach that you probably are looking for. That a lot of times you experience something else because you see something that looks too good to be true, you call, and then all of a sudden you're hooked into, and they confuse you about your health plan options. Guys, I hope this video helps you just to understand that AEP, October 15th to December 7th, is all about changing your Medicare Advantage plan as many times as you want. Our Part C plan is the other name for it, or your prescription drug plan as many times as you want. And then going into the first of the year, watch the next video. It talks about OEP, and I'm going to explain exactly what the OEP season from January 1 to March the 31st is all about as well.